Okay, so welcome to Dr. BKM Institutes and thank you to the Apollo Hospitals and thank you to all of the doctors who have joined us. So it's basically about orientation process of OET. So I would like to tell you about OET one by one. So it's going to be very simple. It's not going to be cheesy test. It's very, very simple. And if we all put in our sincere endeavors, it's not going to be tough at all. The last time we had a batch where everybody passed, and this is the same thing I have promised again to Apollo Hospitals that you all will pass if you will work hard. So it's just about putting in bit of dedication with your with the time that you have, because you guys are really occupied doing your hard work. So whatever time we have, we need to invest in OET. Suppose like 3 to 4 hours a day, sometimes 2 hours a day. But whatever we do, as you do in your practice, you do the best. Whenever you are in, when you are doing surgeries, you are doing anything. So you do your best. The same is expected when it comes to OET. If you have less time, do lesser modules, but do your best. So I'm just going to start the orientation process. I am Dr. Bhupesh, once again from Dr. BKM Institutes, and we have been teaching OET since last 10 years. And you all would be glad to know OET is the only thing we do. That is why we have the expertise of OET. And I'm just going to start the things one by one. So first of all, I would like to tell you, OET has got 4 modules. So OET, as you all know, it has got 4 modules: reading, listening, writing, and speaking. So OET basically is occupational English test. You all know it. And being doctors, what we need is B grade each. That means in all the modules, we need B each, though we would be targeting A. Last time, Dr. Chetali, she gave us 500 out of 500 to score A grade in listening. She also scored, and there were other doctors also who scored A grade in speaking, writings, and other modules. But we need 350 out of 500 that to score B. So these are the scorings of OET. Basically 500 out of 500 or 450 out of 500 will make A. 450 or above will make A grade. That is what we will target. And 350 out of 500, that is B grade. That is what we need being doctors. So when it comes to the individual modules, I will explain you things one by one and will let you know. So I'm taking the second slide. So first I'm starting with the writing module, because this is the module where we all need to work with the grammar. So grammar will be the first thing that we should be doing. And whatever your grammatical mistakes would be, everything would be explained to you each day. So basically OET writing, we can make 4 paragraphs. And it depends upon the situations. There can be different situations that come. When it comes to doctors, most of the times letters come as a visit letter. Visit letter means there would be multiple visits that patient would be doing, multiple visits. So suppose patient, if first time came on 12th of August, and today the date is 30th of August. And in between, patient also visited on 15th of August. Then he also visited on 20th of August. So there would be multiple dates that would be given to us. And we need to write a letter. Writing a letter can be to anyone. It can come as a GP. Suppose if you are a GP, so you would have to write a letter to the psychiatrist talking about patient's health. Suppose the patient when came on the first time on 12th of August, he was having insomnia and other symptoms, insomnia, depression, and other symptoms, which would all be given. Everything would be given in your exam. On 15th August, his symptoms would have worsened. Then on 20th August, there would be further worsening of symptoms. Everything would be given, like what symptoms have worsened. Suppose he has not slept at all. He's talking about various things like hallucinations, visual and audio both. So that can be different data that would be provided to you. And today's date would be 30th of August. So today, suppose if he has suffered from acute maniac episode, and he's talking about different things which is not really, which do not really make sense. So suppose the patient is having acute manic episode. So these are the kind of the different situations. It can be anything. Patient can come up with severe pain. He can have fracture. Then you would have treated something. Something would not have gone right. So you are sending him to the orthopedician for further consultation and investigations. So these are the different kind of letters which come in OET exam. So first of all, in the first paragraph, that makes the 70% of the marks is the purpose of the letter. Suppose the letter that I was just discussing, if something like that comes, so the first paragraph would be about the today's thing, the main purpose. So I would say this letter is being written regarding Mr. X, who has been diagnosed with acute manic episode. On the basis of his current signs and symptoms. So that is the main purpose, that the patient has been found with this, and the grammar we need is has been plus third form, because that is the present perfect passive voice that we will discuss, but I'm just giving you an orientation. So taking it briefly, so we are saying that this patient, on the basis of current signs and symptoms, has been diagnosed with acute manic episode. Therefore, he is being referred. So we are writing to psychiatrist. Therefore, he is being referred under your expertise for management, for treatment. So that's it. That is why OET is the simplest test, and that is how we can assure that you definitely will score very good in OET. If you will understand this thing, it is something that you do every day in your daily practice, and that is the same thing we need to carry on with. So the first paragraph is about telling the purpose. Whatever would be the today's condition, that would be purpose. So today's condition, 30th August, this is the main thing. Second paragraph would be social history and medical history, which is relevant. So obviously we will have a lot of things, in the past he suffered from this thing. That sometimes it can be that his mother expired or something like that. He had depression since then. He was behaving differently. So there would be different things. Second paragraph would always be talking about the background of the patient, social history and medical history. Third paragraph would be during hospitalization, what you did. This will come in the past tense, because whatever you did during the hospitalization has been done. So you will say during hospitalization, the patient was having this and this thing. I'm just telling you the pattern. It would be that simple, having hallucinations. He was talking about some different things. If it is a visit letter, then you will say on first visit. It is that simple. That is what we do practically. On first visit, patient was having this and this thing. So basically we would be talking about symptoms, then whatever treatment we gave. So we can say on examination, the patient was found with. So these things would be told to you. Yes, Dr. Ram, I'm just going to take your question first. I'm just going to unmute you so that you can ask questions. Yes, please. I have unmuted you. Yes, please, Dr. Ram. Did you want to ask some question? Because a hand has been raised. I think it's just like that. So I'm just going to put you. Is everybody understanding until now?
Yes, sir.
Yeah.
Hello.
Yes, sir.
Yes, please. Yes, you may ask any
Hello.
question. Yes, please.
Is it okay if we record this session and can share it later on, because I'm kind of busy today? So will that be okay?
That's fine. We are recording it, but at the same time, when you take the live classes, it is more productive. But if you are really occupied with some sincere emergency, then definitely that's fine.
Sure, sir. Thank you, sir. Yeah.
Okay. So taking it further, so we will talk about the different visits. On examination, the patient was found with this and this thing. Then you talk about the second visit, that patient was having this and this thing. And again, the last visit would be of today. So today, again, you will talk about the signs and symptoms. So in the first paragraph, we have not talked about signs and symptoms. We have just told that on the basis of current signs and symptoms. And on today, you will say today, the patient is having. So everything will come in the present tense. Today, the patient is having this and this thing. On assessment, he has been found with. So these are the main tenses we have to understand, and that we will guide you according to when we will go further. In the past, we will always say the patient was found with, it's a passive voice. On assessment, he has been. So these are the tenses that will change. Whenever we talk about the present tense, we say has been plus third form. When we talk about the past, we say the patient was found with, the patient was diagnosed with. So these are the things we are going to discuss on the way along. And this is the common types of letter that come. There are some tricky letters as well, like this time when OET exam happened just 2 days back, the previous Saturday, there was kind of a referred back letter. Referred back letter means the patient had a GP who sent him to us for treatment, and after treatment he is better, so we are referring him back to his GP for follow-up care. In these kind of letters, obviously medical history and social history are not required, because a person is coming from, person has been referred by the same GP and we are sending him to the same GP. That basically implies that he already knows about social history and medical history. So in these kind of letters, social history and medical histories are not required. So these are the normal kinds of letter that will come in the OET exam. Talking about basics of the letter, basically you will have 45 minutes to attempt the letter. We will take pen and paper based exam, because being medical professionals, we are not really good with the computers. But if you are really good, then you can take computer exam, but we encourage pen and paper exam, simple. 5 minutes, you get to understand the situation. And 40 minutes you get to write, just 4 paragraphs. The total word we need to write is 180 to 200, but we usually guide it should be 190 to 210. So this should be the final word count. So only 210 words. Suppose if I tell you how simple OET is, if I tell you about this word count, which I have written as the first paragraph, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 34, 36. So we have written almost 36 words, means we have written 1/5 of the letter, and it hardly takes like 2 or 3 minutes. So that is why OET is the easiest exam to be taken. If we know what to select in the data, which being doctors, you definitely would be able to do. And if you will select the right data, put it chronologically, means first visit first, second visit, then third visit, and today visit. That is how we need to write chronologically. So it would be a very simple thing when it comes to writing. Basics, I have told you, just 200 words, that's it. 4 or 5 paragraphs according to your discretion and choice. 40 minutes to write, 5 minutes to understand the letter, where pen and where picking a pencil, you can also take it with the pencil, so pencil is not allowed. So this is about writing. So I will like to unmute you to ask you if you have understood about writing. So then we are going to discuss about reading, listening, and speaking, which are very basic. So it's hardly gonna take like 15-20 minutes. So I will really encourage to stay. But still, I would like to ask for any doubt. If you have any doubt, you can ask until now for writing thing. So I'm just gonna unmute you as well. Please, anybody having any doubt regarding the writing, anything that you would like to ask. Basically, writing is nothing. It is kind of a patient we get. It is a kind of a situation we get. So we get different situation. Patient might have psychiatric problem. You might have to write the letter to the psychiatrist. Patient might have a problem with his leg pain. Can be due to anything. He fell 2 days back, but he did not go to the doctor. Then he visited us today. We suspect he's having fracture. So we want to send him to the orthopedician. It can be anything. So you can ask me any doubt whatsoever you have regarding the writing module. And if you have any doubt, of course, yes, Dr. Haritha, you can ask your doubt, please. Dr. Haritha, you have raised your hand. So is there any doubt that I can help you with? I think it's okay. It's just by chance. Any doubt to anyone, please? Should we go ahead with the other modules? Dr. Siddharth, Dr. Raja, Dr. Haritha, Dr. Ram, Dr. Devashish, Dr. Prithvi sir, Dr. Pulkit, Dr. Shalini, Dr. M. Should I go ahead? Yes, Dr. Raja, you have raised your hand. Do you want to ask anything? Any questions? Okay, you are unable to unmute. I'm just going to try it again. Okay, yes, you may ask, sir, please. I have tried again. Now try it, sir.
No, sir. No doubt, sir. Please proceed.
And Dr. Raja, Dr. Siddharth, Dr. Ganguly.
No doubt. You can proceed, sir. No
Hello,
doubt.
sir.
Yes, doctor. Yes, ma'am.
Yeah, this is all about the referral letters only, like
Mhm.
nothing other than this.
See, most of the times, Dr. Harita, see, there are kind of, letters where patients are usually admitted and it's discharged. But most of the times in the last decade, in the last 10 years, what we have seen with the doctors, that most of the times you refer the patient to a senior doctor. So basically you act as a GP, where the patient has come to you with various problems. You resolve his or her problem, but you are unable to treat him well. So that is why you need an expertise of a doctor who is specialized for that particular field. So these are the most of the letters that will come.
Okay, sir. Okay.
Other letter that I have discussed is kind of a referred back letter where
Back.
GP sends to the patient. So don't write about socialist, and it is given intentionally so that you can commit mistake. If you write social history and medical history, exam is gone. So that is how.
Okay. Okay, sir. Thank you.
We will be doing different letters on the way around. You will be getting to know everything. It's basics. What we need to work on, what I have seen in the past teaching doctors, sometimes grammar is one of the sections where we need to work hard. And then data selection can be bit of challenge in the start for like 1 week, and the rest 3 weeks of the coaching become very, very simple. So then it's not a problem. So the second thing I will take you along is with the speaking session. Again, speaking session is also very practical. Patient comes to you with different situations. Like if I show you some kind of task, so what happens is that the task normally starts like patient has come with a headache. Everything would be given to you. A role play card would be provided to you where everything would be explicated up. You have to create nothing from your side, nothing. So everything would be given. Suppose this is the role play I have. So it is for the nurses, but I'm just taking it along. So everything, like if I make this role play for the doctors, the son, daughter of an 80-year-old woman has come to ask about the cholesterol. She wants information about her mother's cholesterol level, how to reduce it. So basically, being a doctor, you are attending son or daughter of a patient. So you need to tell them that, what is, so first of all, you need to ask the question, do you know anything about cholesterol? So you will say, good morning, my name is Dr. Ram. I'm your doctor for the day. So how can I help you? Well, doctor, I'm here for my mother. I would like to know that, I could see her case notes that it says that she is having fairly high level of cholesterol. So I would like to know what exactly is the level of cholesterol, and what is cholesterol. Okay. So before I can explain you, I would like to ask you, do you know anything about cholesterol? No, doctor, I have just heard about cholesterol. I don't have much idea. Okay. So let me tell you. First of all, cholesterol is a fat-like material present in the blood and in most tissues. And there are two types of cholesterol: high density lipoproteins, which is good, and low density lipoproteins, which is bad. So basically, cholesterol is a fat-like material that is present in our body. So we need to keep it under control. In your mother's case, it is fairly high. So that is why we are concerned. So what cholesterol does, it is like the fatty deposit, which can get lodged in the arteries, and this can lead to various kind of diseases like heart disease or stroke. So that is why your mother, now she is 80 years old, and after getting through the investigations, we have come to know that cholesterol is fairly high. So it is very important to control this cholesterol level at this stage. The third thing I would like to tell you, that fairly high level of cholesterol means that in your mother's case, it is elevated above 5.5 millimoles per liter in the blood. So that is why we have told that this can get lodged in the arteries. Now your mother is vulnerable to these kind of diseases, having fairly high level of cholesterol. So are you understanding my point? So that is how you will ask the person. And then you will say, okay, advise your visitor, his mother can deal with her cholesterol, like avoid saturated fats, eat more fibers. So now I would like to tell you that how it can be avoided. First of all, it is very important to avoid saturated fats like buttermilk, or any kind of thing that is made up of dairy products should be avoided. Furthermore, of the fibrous, raw vegetables, raw and fruits should be added in the diet of your mother. So this will help to decrease the LDL in your mother's body and will increase the HDL, and also this and that. So you need to talk about different kind of role plays. So basically, this is the only thing that you need to do in the speaking. So basically, but again, I'm telling you that OET is very easy thing, but it needs practice, because fluency, like if I'm talking to you right now, So I'm fluent with my words. That is required. So for this, we need practice. So we will have individual sessions as well, where you will be given a role play each day, where we will practice about this thing. You will be given a writing every day. So we'll discuss about the writing things. Then you would be given reading and listening things, where we will discuss about the reading and listening too. That we will decide on the way ahead, like whether you will like to have cumulative sessions or the individual sessions according to respective timings of the day. So we can provide you flexible timings from 9 a.m. to almost 7 or 8 p.m. according to your discretion and choices, according to your day schedule. We can keep on shuffling the timings every day. So this will ask for an individual attention that we will give you. There is nothing to worry. We will have different timings. But at the same time, if you want cumulative sessions, we will definitely have 1 or 2 cumulative sessions in a week, where we will be guiding you and taking you along with reading and listening session as well. So the third thing, so we have discussed about writing and speaking. Speaking, basically 2 role plays of this kind will come. So we have discussed just 1 role play. So in exam, you will have 2 role plays, 3 minutes you will get to prepare. The most important thing in OET is there is no marks for the facial expressions. These are the important instructions which you need to understand. Facial expressions does not have any marks. Expressions do not have any marks. So basically it's all audio. So you have to be little loud, not too much loud, but you have to have the adequate loudness, and fluency is the key when it comes to speaking. Grammatical mistakes should be avoided, but 1 or 2 can be accepted very easily in speaking. But again, we need to do the best. If you want to score A grade and want to take 450 out of 450, 450 out of 500, which is A grade, for that we have to practice really hard. For B grade also, we need to be there. We need to be fluent. If we are not fluent, definitely there are a lot of marks which would be deducted. Third thing when it comes to OET is the reading session. So reading session is divided into part A and part B. Part A will have 20 simple questions, but you will get only 15 minutes to prepare, 15 minutes to execute the task. Then they will take your sheet away. So you will have 15 minutes and 20 questions would be fill in the blanks. So this we will discuss on the way ahead. But just to show you, I can do one thing for you. Just to show you, if I can take you one of this reading. Yeah, so that's one of the tasks which you can see. It is kind of a text A, text B, text C, and text D. So then you will have a question paper like this, where you have to do 1 to 7 questions are just to mention in which text the information has been given. So you just have to write A, B, C, D, and this. Then we will have the fill in the blanks up to 20th question. Then there would be multiple choice questions in the reading part B and C, which we will again discuss along the way. But then you will have 45 minutes, which is ample amount of time. So in the part B and C, timing is not a problem. In the part A, they want to check whether you get anxious or you don't get anxious. So that is where different ways of testing you being a doctor have been portrayed in this particular OET exam. That in the part A, they check whether you get anxious or not. In the part B, they check that if you are given good time, if you can make the right multiple choices. So again, with doctors, we always expect that they should give us A grade rather than B, because it is just a step towards your better future, and towards your more the studies that you want to take. But at the same time, this is an important step where you would be, if you would be taking A grade, you will feel certain kind of empowerment towards your further achievements or the further process that you need to follow. So A grade definitely boosts lot of confidence and lot of things to you. And also when you actually would be practicing in foreign countries or over here, you would be attending patients in the same way. So I have told you about writing. Writing basically just 1 letter, 45 minutes, 5 minutes you will get to prepare, 40 minutes you need to write. Then you get a speaking session where there would be 2 tasks. 1, you will be doing the task, and second, 3 minutes to prepare, 5 minutes to execute the task in both the things. Then third would be the reading section. Reading section again, part A and part B. Part A has 20 questions, part B has got almost 22 questions, so overall 42 questions. Out of that, if we score around 32 to 36, we are scoring very good. More than 36 will get the grade that we are looking forward to, that is A grade. For B, 32 to 34 or 35 would do according to paper. It depends upon the exam, because it is like a percentile method. If the exam is easy, the cutoff is going to be higher. If the exam is difficult, the cutoff is going to go lower. So there is no fixed grades like other tests, like 30 out of 40 will make seven bands. It's not like that. In OET, everything depends upon the exam. The same thing applies to listening. Listening also has got like 24 questions in the part A. In reading, it is 20. In the listening, it has got 24 questions in the part A. And then you have got rest of the questions, that is 18 questions almost in the part B and C, that you have to listen and to do your well. Again, part A is fill in the blanks. Part B and C are more of multiple choice question. So this is what OET is all about. Rest, I would like to ask from you guys if you have any questions regarding OET and its orientation. Again, I could have stretched this session for sure, but then again, we will feel cumbersome and clumsy. So I don't want you to have the first day as your hectic day. Again, we will be doing different things. We will have cumulative sessions in between. And then on the way ahead, we will also have individual sessions almost Monday to Friday, almost every day, except one holidays a week, except one holiday in between. Saturday, Sunday is always off. And the rest, you can ask me any questions whatsoever you would like to ask. Any questions whatsoever. Please.
Sir, Dr. Raja here.
Yes.
Sir, how often can we take this exam, or is it like monthly once, or like how is it?
So it's couple of times in a month. Earlier it used to be once in 2 months when I started teaching. Now it happens like couple of times in a month. Like the coming exam is on 10th of September or 27th of August. It happened 10th of September, then 24th of September, then 8th of October, then 26th of October, or something like that. So it's 2 times in a month.
Okay. Is there any limit, sir, to how many exams you can take? Because I heard IELTS has some limits like that.
But I promise you won't have to take it second time. If you would go,
Okay.
it's an assurance that you surely will pass.
Okay.
It is very
Thank
easy
you, sir.
because it belongs to our profession. It is not something that we have to create. There is no specific vocabulary which is required. It's just the simple terminology that we normally use in our daily practice. That's it. There is nothing much. Listening, we will need to practice a lot. Listening, you definitely need to practice, because doctors, when you achieve higher levels, we have less habit of listening. So that is where we need to work harder. And then reading, writing, and speaking will eventually go fine with the practice. So you
Okay,
don't
sir.
have to
Thank
worry.
you.
Last time also everyone passed, so don't worry. Any other question, please?
Sir, Dr. Ram here, sir. So, how are we supposed to take our exams? Like, how many days we have this program with you, and when are we supposed to take the
So that
exams?
is obviously we are still in the conversation. So we will start after like after like 2-3 days or maximum 5 days, and then after a month we will take the exam. So after like 2 or 3 days of coaching, we will start filling our examinations, because it has to be filled almost 25 days priorly. So if we take a course of 4 weeks or 5 weeks, then in that case, after a week we need to fill the exam. So most probably we will start on 5th of September and maybe earlier. That I will confirm you over the WhatsApp group for sure after talking to Prithvi sir and Shalu ma'am. Any other question, please? Okay, so it's not a problem. See, honestly, if you don't have questions, I don't feel bad about it. If you have questions, obviously I feel better. But if there are no questions, I don't feel bad, because sometimes the things are so easy that they need not be complicated. That is what OET is all about. It is such an easy test. It doesn't require any complication. Whatever we are talking, the way it is looking at present, the way it is being heard by you at present, it is that easy only. So we just need to be there. We need to be good with our spelling. Don't commit any spelling mistakes. Dr. Neha, she is the owner of our place. She would be along with us to guide you with your writings. And if I show her grade, like we have been teaching for a very long time, and that's basically her grades when she took her OET in reading A, in writing A, listening, speaking B. At that point of time, there was nothing like C positive or something, and there were no 350 out of. So these kind of scores used to come. So she would be there to guide us on the way, and she will check your writings along the way, so you don't have to worry about anything. and it would be simple visits letter. We will practice some discharge back letters, some referred back letters. There would be different kind of letters that will come along the way, but again, the pattern will remain the same. First is purpose. If purpose is good, everything is good. Then we will write about the social history or medical history so that we can tell the background. Obviously, then we will talk about in different visits what happened, and now what is why the patient is being referred would be explicated in a better way. Like in the first paragraph, we just say the main thing. In the last paragraph, we explain the symptoms, signs, and that is why patient has been found with this thing, and that is why he's being referred. Sometimes it can be suspected case as well. So rather than diagnose word, we say this letter is being written regarding Mr. X, who has been suspected with this problem on the basis of his signs and symptoms. So he's being referred to you under your expertise for definitive diagnosis and further management. So that is how the words shuffle. Again, we know about these things very easily and nicely. Is there any other question that I can help you with? Anything that you would like to ask? So all good for the day? Is it okay for being the orientation? I will flick you some things over your WhatsApp as well. So it's just a part of an orientation. We were engaging in the conversation. Now I will send you a few bit of things where you can learn a lot more about rest of the things. And also I will send you one reading video as well. If you will watch that complete video of reading, that will also help you to understand how to execute. So we will talk about different methods, because in OET, reading is little trickier because you do not find the exact answers. So elimination method is the method that we say. Elimination means A is not matching, eliminated. B is not matching, eliminated. C is not matching, eliminated. That's why D becomes the answer. It is one of those options which is matching, but it is not exact. So that is why we need to use the elimination method rather than direct that this is the answer. You will not find the direct answers. So that would be a little bit of trick which we will learn along the way. Is it all good? So Monday probably is the day we will start the coaching and everything. So Monday you should all be ready. And again, I assure you that there would not be any kind of bigger hurdles if you devote like 2 to 3 hours a day, which I really require. And those 2 to 3 hours should be like, this is for OET. That is the only thing I need from you guys, whether it is in the night time. We will try to compromise with the timings. We will try to adjust with the timings. It's not a problem for us. But yes, after 9, it becomes a little tricky. But in the last session, sometimes, doctors used to do that. But we again carried along the way because we understand that you guys are really occupied with your work. So we'll try to get along with you and try to fit in according to your schedules. So is it all good? So should we call it a day for the orientation process? Is it all done?
Yes, doctor. Yes, Dr. Bhupesh.
Thank you so much. Thank you so much. Take care. Thank you. We'll catch you on the way. Thank you so much.
Thank you, sir.
Thank you.